We're going to take a look at some of the drugs that affect the autonomic nervous system. So there are a lot of drugs that do affect the autonomic nervous system, but we're just going to look at one example. So these are drugs that are called anticholinergics. And so if you look at the name, they are going to block acetylcholine. So the anticholinergics are actually going to block the muscarinic cholinergic receptors. They're muscarinic antagonists. So they're going to compete with acetylcholine to bind to the muscarinic cholinergic receptors. And if they get there first and they bind, being an antagonist, remember antagonists will bind a receptor and then they produce no response, so nothing will happen. And where do we find muscarinic cholinergic receptors? So if you remember that the muscarinic cholinergic receptors are going to be located on parasympathetic target organs. So when you give one of these anticholinergic drugs to someone, what it does is it basically blocks the parasympathetic nervous system. And remember that you always have both the parasympathetic and sympathetic nervous systems active at the same time, and you just can dial up or dial down their activity level. So by blocking the parasympathetic nervous system, all you have left that's active is the sympathetic nervous system. So as we'll see, giving one of these anticholinergic drugs is like just activating the sympathetic nervous system because you're blocking that parasympathetic nervous system input. So some examples of drugs that are anticholinergics, atropine and glycopyrrolate are two of them, and there are some others as well. Where atropine actually comes from are some plants. So it comes from nightshade, and then the other plant is jimsonweed and also called sacred datura. We actually have this growing down in southern Utah. You might have seen it. It has some really big kind of whitish flowers that bloom at night. So you might have seen that, but it does contain atropine, so it is poisonous, so you don't want to be eating it. When we give a patient an anticholinergic drug such as atropine, we're blocking the parasympathetic nervous system, and all they have left that's working is the sympathetic nervous system. So it's like their body has seen the bear. So it's jumped out at them, and so all they have is just the sympathetic stimulation, and they don't have that counter effect of the parasympathetic stimulation at all. So the reason that we would give an anticholinergic drug such as atropine would be to have those sympathetic effects. So for example, if your patient's heart rate is too low, you could give atropine to increase the heart rate. So that might be one use. Another use of atropine, they actually use it as eye drops, and that's because it dilates the pupils. So we would use that, for example, if the patient had some inflammation in their eye, which causes the pupils to constrict, which can be very painful. And they would get some atropine eye drops to put in there, and that'll dilate the pupil and relieve that pain. And then another use we could see atropine used for is that if the person has diarrhea, some of the anti-diarrheal medications, in addition to some other things they have in there, but some of them do have atropine in them. And so why would they put atropine in there? So think about what the sympathetic nervous system does to the GI tract. So remember, it's going to decrease GI motility. And if you decrease the GI motility, the feces will stay in the GI tract longer, and that'll allow you to absorb more water and that will firm up the stool and that will decrease the diarrhea. So that's why they do that. And there's some other uses for atropine as well, but those are just some of the main ones. And then these are just some other drugs that also affect the autonomic nervous system. You can read through them. You don't have to memorize any of these, but just remember just some of the terminology. If you see the word agonist, remember an agonist is something that binds to a receptor and produces an effect. And then remember that an antagonist is something that binds to the receptor and produces no effect. So basically it's blocking that receptor. And so you can see that we've got some of these are going to be blocking the muscarinic cholinergic receptors or activating them, and then others will be binding to some of these adrenergic receptors or blocking them. And then some of them will actually be inhibiting, for example, the acetylcholinesterase enzyme. So there's lots of targets here in the autonomic nervous system that these drugs can go after. And you can see some of the things that they can treat. So interesting to read through, but you don't need to memorize any of those. All right, so this is table 11.3 from your book. And I would just read through this and be familiar with the effects on the body that the autonomic nervous system has that we talked about. So remember, we did talk about the effect of the sympathetic and parasympathetic nervous system on the heart, for example. So remember, the parasympathetic nervous system rest and digest, that will decrease the heart rate. And sympathetic nervous system, fight or flight, that would increase the heart rate. And then the other thing to point out, remember we talked about most organs having dual innervation, and you can see that here. So like the heart is innervated by both parasympathetic and sympathetic nervous system, and you can see they have antagonistic effects. They have opposite effects. But here we've got an example here with the blood vessels. The smooth muscle is only innervated by the sympathetic nerves. So that's going to cause the blood vessels to vasoconstrict or vasodilate. And parasympathetic nerves don't innervate the smooth muscle around the blood vessels. So that's an exception to the dual innervation there. And then some of these others we talked about, like with the bronchodilation, bronchoconstriction in the lungs. We talked about the GI motility. Some of these others we didn't talk about, like the pancreas. So don't worry about that. We did talk about the saliva production. So look at that. And then we did talk about the urination, how sympathetic would decrease that and then parasympathetic would increase that. Okay, so just kind of look through these and just look at the ones that we talked about.